Internal Medicine for 8th semester students of the Faculty of Medicine. Internal Medicine. Definition of internal medicine. Internal medicine is a branch of medicine that focuses on the prevention, diagnosis, management, and treatment of diseases affecting the internal organs of the body without the need for surgical procedures. IPD encompasses various subspecialties involving nearly all body systems, such as cardiovascular, respiratory, gastrointestinal, endocrine, renal, hematological, and immune systems. Physicians specializing in internal medicine are called internists and are responsible for managing both acute and chronic conditions in adult patients. Learning objectives of internal medicine in Semester 8. In Semester 8, medical students study internal medicine to understand the fundamentals of physiology and pathophysiology of internal diseases. Develop basic clinical skills such as taking medical histories, performing physical examinations, and making diagnoses. Master the basics of interpreting laboratory and radiological results. Formulate therapeutic plans based on evidence-based medicine. Familiarize themselves with a multidisciplinary approach in patient management. Scope of internal medicine 3.1 Cardiology, cardiovascular system, coronary artery disease, CAD, pathophysiology, caused by atherosclerosis, the buildup of fatty plaques on the coronary artery walls, leading to narrowing of the blood vessels. Stages of CAD, stable angina, chest pain triggered by physical activity and relieved by rest. Unstable angina, more frequent, intense chest pain, occurring even at rest. Myocardial infarction, total blockage of a coronary artery causing heart muscle damage. Diagnostic tests, electrocardiogram, ECG, shows ischemia, ST depression, or infarction, ST elevation. Treadmill test, to identify ischemia during physical activity. Coronary angiography, visualizes blood vessel blockages. Treatment, acute, nitrates, antiplatelet agents, aspirin, anticoagulants, thrombolytics, in case of acute infarction. Long-term, statins, ACE inhibitors, beta blockers, lifestyle changes. Hypertension, high blood pressure classification. Primary hypertension, cause unknown, 90–95% of cases. Secondary hypertension, due to other conditions like renal artery stenosis, pheochromocytoma, or chronic kidney disease. Complications, stroke, heart failure, kidney failure. Diagnosis, blood pressure measurement is greater than or equal to 140/90ths of a millimeter of mercury. Supporting tests, renal function, electrolyte levels, and ECG. Management, lifestyle modifications, diet, exercise, weight loss. Antihypertensive medications, ACE inhibitors, ARBs, diuretics, calcium channel blockers, CCBs. 3.2 Pulmonology, respiratory system, asthma pathophysiology, chronic inflammation of the airways causing bronchial hyperresponsiveness. Tests, spirometry, decreased FEV1 FVC ratio. Bronchodilator test, improvement in lung function after bronchodilator administration. Management, long-term control, inhaled corticosteroids, LABAs. Acute attack, short-acting bronchodilators, salbutamol, oxygen. Chronic obstructive pulmonary disease, COPD, pathophysiology, alveolar damage due to chronic inflammation, often triggered by smoking. Stages of COPD, based on spirometry and FEV1 capacity. Management, smoking cessation, bronchodilators, long-term oxygen therapy. 3.3 Gastroenterology and hepatology, digestive and liver systems, gastritis and peptic ulcer causes, H. pylori infection, NSAIDs, alcohol. Treatment, PPIs, omeprazole. Antibiotics, clarithromycin plus amoxicillin. Liver cirrhosis pathophysiology, liver fibrosis leading to portal hypertension. Complications, ascites, hepatic encephalopathy, variceal bleeding. Management, diuretics, variceal ligation, liver transplantation. 3.4 Endocrinology, hormonal system, diabetes mellitus, DM, types. Type 1 German mark, Type 2 German marks, gestational DM, MODY. Complications, microangiopathy, retinopathy, neuropathy, macroangiopathy, heart disease, stroke. Management, insulin management, lifestyle changes, medications. Hypothyroidism and hyperthyroidism symptoms. Weight loss, fatigue in hyperthyroidism. Weight gain, constipation in hypothyroidism. Management, levothyroxine for hypothyroidism, antithyroid drugs for hyperthyroidism. Addison's disease and Cushing's syndrome. Addison's disease, adrenal insufficiency. Symptoms include fatigue, weight loss, orthostatic hypotension. Cushing's syndrome, chronic exposure to high cortisol levels, causing central obesity, striae, and hypertension. 3.5 Nephrology, kidney and urinary system, chronic kidney disease, CKD, stages 1 to 5, based on GFR. From mild kidney function decline to end-stage renal disease, ESRD. Complications, anemia, secondary hyperparathyroidism, renal bone disease. Management, blood glucose control, dialysis. Kidney transplantation, acute kidney injury, AKI, etiology. Prerenal, hypovolemia, renal, acute tubular necrosis, postrenal, obstruction. Management, Treatment according to etiology, rehydration, dialysis, kidney stones, nephrolithiasis, symptoms, colicky pain, hematuria, nausea. Diagnosis, CT scan, urinalysis. Management, increased hydration, pain management. Extracorporeal shockwave lithotripsy, ESWL. Urinary tract infection, UTI, etiology, E. coli bacteria. Symptoms, dysuria, frequency, hematuria. Treatment, antibiotics. Prevention with hydration and hygiene. Learning components theory. Lectures on disease mechanisms, risk factors, symptoms, diagnosis, and therapy. Review of recent literature and evidence-based management protocols. Practical. ECG interpretation, radiological result analysis, X-ray, CT scan, MRI. Organ function tests like spirometry for lung function and liver function tests. Case discussions. Students discuss hypothetical patient cases, identifying symptoms, differential diagnoses. Proposed investigations and treatment plans. Simulation and clinical observation. Interacting with simulated patients for clinical skills training, direct hospital observation. This translation retains the structure and content of your original text, aiming for clarity and coherence in English. Let me know if you need further modification.